Okay, so it is March 11th at 7:30 p.m. And so the meeting of the Board of Health is called to order. In terms of the minutes from last meeting, that was from January.
Yep.
Yeah.
Any additions, corrections?
No.
So a motion to approve the minutes?
I'll second.
All in favor?
Aye.
Any opposed? Good, so
Hi, Henry.
minutes are approved. Good, so we can, hey Henry, so we can go ahead to Director's report?
Sure. So I thought we'll talk a little bit about some of the activities over the last 2 months. So we've continued to offer vaccinations by appointment only. We are looking to sort of push out COVID vaccine as we have a little bit left, and it's getting down to the expiration date in the next month, so we're working on that. Our community health program has initiated their annual Matter of Balance program. So it's an 8-week program that they're doing at the senior center, Thursdays 10 to 12. And so we've got a full capacity class. And so Santina Duranco and Julie McCullough, our public health nurse, run that together. They also, during February was Heart Month, and so they offered 4 Know Your Numbers screenings each week. And in the Know Your Numbers, we haven't probably had talked about it in a while, but it's basically they do a screening to give you your blood pressure, your weight, your blood glucose level, your A1C, there's a few other things. But we have a little screening machine that we bring out, and it's a collaborative effort with the folks from the Health Improvement Alliance, which is a consortium of all the health-related providers, hospitals, health departments, clinics throughout the region that we do a lot of work with. So they all do it during the month, and we do, all collectively, hundreds of people. So it's, basically getting people into understanding what your numbers are and tracking them over time. We also had some of the staff and the town folks do a Wear Red Day, and took some pictures of that and posted that on social media. We did have an American Heart Association staff member scheduled to talk, and that was canceled due to snow. And they're working on rescheduling that. We spent a fair amount of time the past 2 months planning and executing a reunification exercise. This is the first part of a series of events related to this. So working with the emergency management director and the school's safety and security officer and director of operations, we conducted, and police, conducted a large training. We had 190 individuals up at Black Rock Church, and had a speaker come in, Dr. Dan Rector, who goes around the country giving talks on teaching municipalities and school systems how to conduct a reunification exercise if there was an event at a school where students had to be removed from the school quickly, and this is the process to reunify them with their parents properly. So we did have the event on the 5th of March. It was very successful. We had people from all over Region 1. We had the head of Emergency Management and Homeland Security for the state of Connecticut present there. We had our region's emergency manager present there, Bob Kenny. We had the first selectman came, and a few other folks from DEMIS that have different positions in emergency management around the state. It was the first of these large-scale events, trainings that we did that has been done in this state. So I think they all wanted to come down and see how it went. But it was basically a training and then a functional exercise where in the facility we set up a smaller version right in the auditorium and ran people through where we had parents and police officers acting as the children, and we had set up tables on the stage and had people come in and go through the process of, checking IDs, and you have to fill out a card, you check your ID, you check the list of kids, and you move through, and it's just that whole process. And then at the end, they did a sort of walkthrough of the facility of the church to look at the actual spaces that would be used during that time. And it's really just about sort of having people see them, think about how they might want to adjust any plans related to that. So this will be followed by trainings at the schools. The leadership of each school will have a training with their staff to present this material, and then they'll develop a plan to implement that. And then sometime in the summer, we have a tentative date set, but it's not firmed up yet, but we're planning a full-scale exercise where we'll have, we'll conduct the entire thing with all the signage, mock students, all of that, sometime in the summer is what we're currently planning on. So that was a large effort by lots of people, particularly the emergency management director. And so we look forward to sort of continuing that planning as we go forward.
I'm sorry,
Sure.
Can I just ask you a question? So is that for, is that the only place in Region 1 where
No.
we're running that exercise? Okay.
Well, so the concept of this was we offer the training in Region 1,
Mm-hmm.
go back to your schools. There's people from all the different school systems
Right.
throughout Region 1.
Mm-hmm.
Go back to your schools, present this material, and then come up with your plan. I mean, and it's not a large lift for schools in the sense that they do reunification every single day.
Right.
Okay, they do it after fire drills. They do it on lockdown drills. They do it at dismissal every day. So it's just about getting them to think about how would you do this somewhere else.
Right.
Teachers go with the students go to one location, parents go to one location, and it's just doing what you do every day at a different location, minus the, they're the bus folks, they're the walkers, they're the parent pickup. That all goes away, and you have to sort of connect every kid. But the idea is to take it back to your area. A lot of the emergency management directors from the region were there, and the training was designed to motivate them to do this in their district and to plan their own exercises, if you will.
Great, thank you.
Sure. We had the grants that I've been discussing, the workforce development grant, the immunization grant, and those have been fully approved, and the contracts are now finally executed. And so we have conducted interviews for the staff, and we've hired our billing coordinator, we've hired our community health worker, and Santina and Julie, the nurse, are doing interviews for a vaccination nurse, and so that they will start hopefully within the next few weeks. We'll get those, and so the staff will be on board to start taking on the projects. So we're happy to have that done. In addition, we've been participating in, the state has been holding monthly webinars on what they're calling migrant welcome. So it's about conducting planning for if a group of travelers, if you will, were to show up in your town, whether it be on a bus, a chartered bus, or in some way they show up at your town, what's the process in your municipality of how to handle that? And so we've participated in a training to talk about that, which was, New Haven and some of the larger cities that have this in place already have shared sort of their plans, and sort of, again, encouraging towns to develop their plans. And it's just really a plan for it's like a 24-hour plan. Where can you house them? Where can you provide them food, water, shelter, medical care if need be, for about 24 hours. And then the state comes in with all the resources that you need. They'll connect people with hotels if they need them. They'll get people to where their ultimate destination is with train tickets and bus tickets and things like that. So it's just about sort of having a plan on paper and thought through, and then people trained to understand, what happens when a bus pulls in at 2 a.m. and people start getting out. You have to, respond to that. So that's what we're starting to work on. We did have, I think I shared last meeting in person about the SantaCon event that happened in December. We did hold a public forum at Fairfield Ward High School in the evening, and got, there's probably 200 or 300 people, between 200 and 300 people there, and had representatives from Fairfield University, representatives from Lantern Point Association, the first selectman, the police chief, fire chief, and they were all there. We're on a big table up front, and basically, people lined up to ask questions and make statements, and so we were there to try to answer as best we could to all those comments and take notes on what they felt were their concerns. And it largely echoed, they all echoed similar themes of, doing what we can to try to prevent it from happening, but that's, it's a private event on private property, so that's not the most hopeful of scenarios. And so it's just looking at, what strategies that we could do next time around to minimize the impact on the neighbors and the area and on the attendees themselves in terms of their own health. And so it's largely, the suggestions were largely things that the town leadership came up with as well in the university. So we'll continue to work on that. I did have the opportunity to present this past month. The Department of Public Health asked us to present on mass dispensing. So they're doing a series of, in preparedness, there's 15 capabilities that were supposed to be at some level on all of those. And so the state asked us, because we were, during COVID, one of the highest vaccinators in the state, and so they asked us to present on sort of what we did during mass dispensing, and to go through sort of the criteria within Capability 8. And so it was a good opportunity to present on that and to kind of tout a little bit of what we did during COVID to provide vaccination services. We continue with our municipal meetings. Those are, we have a lot of those. It seems like there's a couple every week. This is our transition to a new database, where we're down to the end of close to two or three more meetings in phase 3 of 5 phases, and so this is when we spend a long time just going over, what about this variable on this form? Date, do you want that? Yes, we want the date. What about this last name? Yes, we want that. Business name? Yes, we want that. And going through these minute details to say, and it's surprising how much, variability there can be. And, when we say, we want this data to be able to print out this report. And we go back and forth with, and they say, no, we can't do that in our system because it doesn't work that way. And we say, yes, wait, I think you can. And then somebody else comes on the line from their company and says, yes, we can do that. So it's a lot of that, but we're working towards it. We're looking forward to sort of rolling out a new database that, connects all the licensing and permitting going on in the town in one system, provides, better field inspection capabilities, and so we're looking forward to that, but it's a lot of effort. We did have a meeting with the Fairfield Beach stakeholders again, This is a twice a year meeting, one before, typically in August, and then one in January, February time, sort of talk about issues and for people to, make suggestions and, voice concerns. And again, it's police, fire, emergency management, Fairfield U, the associations that are various associations down at the point. So again, it largely there's not a lot of involvement for us other than what we do normally is, investigating overcrowding complaints. And so there'll be a few questions about that, but we typically are listeners there and talking to people about how we can, how we can ensure that people are complying with the laws related to us down there. And so some of the suggestions from residents there, we've issued a lot of orders in the last 2 months for dwellings where they suspect it's rented without a certificate of rental occupancy. So that gets us in there and to do an inspection. I'm stealing Rob's thunder probably here. I'll skip that. We did, once a year, we have to have a technical assistance call with the national representative for the Medical Reserve Corps. So we just conducted that, where it's essentially an assessment of how are you doing and, what are you working on now, and sort of a presentation of their objectives. Every so often, there's new leadership. This program was, within the last few years, transitioned out of the Office of the Surgeon General to under the Assistant Secretary for Preparedness and Response, which is a much more response-related organization, part of Health and Human Services. And so that leadership brings with it new criteria, new expectations. And so we're working to sort of adopt those and move forward. And so it was a positive meeting. I did have the opportunity to present. I teach the disaster psychology portion for the community emergency response team. I did have an opportunity to do that presentation on the 2nd. Thought it went well. Myself and Rob and Santina worked on, so we have a new website now. I think I shared that in months past. So what that necessitates is a change in how we do. We have an email notifications list with thousands of emails on it for people that want to be notified when the beaches are closed. And so the notification system changed with the new website, and so we've had to recreate a new way of collecting that information and letting people know that we weren't able to import the old list into the new list, so we had to get the new system set up, functional, and then email out all the old people. We were able to get the email list of the old people, and so that were on the list, and so get that out and get that set up and sort of talk through how we're going to do, how we'll handle beach closures and the notifications this summer, which will be slightly different, but the website is actually provides some great tools that is a little bit simpler than the way we used to do it, and we'll decommission. We used to have a dedicated website called Fairfield Beach Updates that is linked to all the other town pages and things like that. So we're decommissioning that site, letting people know, creating a new site on the town website. So we're working on that. We did have another meeting this is the first meeting with the new first selectman and his staff, along with police, social services, and emergency management, to talk about the use of the opioid settlement funds. So the town receiving funds over the next 15 years from this settlement, and so we're sort of looking at the strategies of how are we going to roll this out, and the new administration has some wanted to put a pause on it until they got into office, got things worked out, and then we're starting the process of looking at putting in, how are the funds going to be used, and what are the systems that we're going to use that, whether it be mini grants or hiring or putting out to bid certain aspects of that, whether it be counseling or education, things like that. We're focusing, it'll really be a focus on harm reduction, trying to offer some type of direct service, substance abuse recovery service, outpatient counseling, and education in general. So we're working with that. We are working our way through the budget process. We've met with the First Selectman's office to review the budget and our requests. Really no big changes in our budget, other than we're requesting 2 part-time nurses to cover the new school, Covenant School in town. It's made it through the Board of Selectmen. They've approved it, and we did our presentation to the Board of Finance last week, and so they still have a couple weeks before their final vote, but there was no significant questions or opposition to the proposal. And we did have a retirement, John Oldham, and I don't know if many of you have met him, but one of our sanitarians has been here for quite a while, retired January 31st, and so the position has been filled. We had an in-house person that we've been training for the last, since July 1st, Kim Wynn, who's, public health grad, already has her MPH, interested in transitioning to environmental health. So she's been working for the last, 8 months on getting her certifications and licensures. And so she's moving forward to that. But we've transitioned her into, she doesn't quite meet the criteria for John's level position, which is sanitarian A. So we've worked with the union to downgrade the position to a sanitarian B for a time. And then once she gets her licensures and all of her certifications, because it's not really her fault in the sense that the state takes a long time to get out and certify people. At the time that she meets all that criteria, the position will revert back to a sanitarian A. And then I did want to do just a quick...
Sorry, Sam,
sure.
just a quick question. So that means you'll be recruiting for sort of I would call it Inspector 1, but sanitarian C, I'm assuming the letter.
We have A and B,
Okay.
A being the higher level, B
Okay.
being entry level.
Mm-hmm.
And so right now, Kim was in a sanitarian B position on a grant. And so that grant will ends June 30th. So we don't think it will find anybody to work for a few months under that.
Right.
We'll transition her to, she's actually been offered and accepted the position and has, moved into a sanitarian B position, with the town.
So is the department going to be short a sanitarian then?
Well, Kim was operating sort of, so we had full staff.
Okay.
Kim was an additional staff.
Okay.
So Kim's position we're going to talk about whether it goes away or not, or whether we'll look to recruit a new person, new sort of beginnings, new to the profession type person, and begin that process. It's hard on the staff to train new people, and we've done it 3 times in the past year and a half, and so it asks a lot of the staff to take that on. So we may put a pause on that for now, but we really haven't had those discussions yet. So
Okay. Just because again, as we're well aware of these, even though she was on a grant, I'm sure contributed, to the workload. And
no,
now
she was great.
Down one.
Yeah.
One person.
But her, so she was, one of the things she was helping us with significantly was the transition to Municity, which helped her to learn all the nitty gritty about, what are all the licenses we issue, what are all the forms, the applications, all the details of that, when do they expire, what's the, late fee, all these nitty gritty of how the systems work here. So she carries that expertise forward. And
okay, so it was less the actual inspections.
She was doing those as well,
right.
But the project that we had assigned to her, the environmental project, was helping us with the transition. So she's the one behind the scenes working with smart sheets and uploading So, you need to, you need to upload a list of the violation type categories, And so she'll type those up, she'll run it by Rob, run it by the staff and say, okay, here's our list of violation types, is it consistent with our last 2 databases, that kind of thing. So we don't lose data, historical data, and so she's doing all that work, and she's very good at it, she's very meticulous, which is what we need.
I would just encourage you, again, as opposed to getting behind, I'm sure the board would support, making sure that the staff is staffed to the level that they need to be in order to do what they need to do.
We actually brought on, because of the change to the FDA food code, so I think we've shared in the past, you may not have heard, the state changed the food code. So going from a state food code to a national food code, the FDA food code, which is a much more intensive food code, and the inspections take longer. So what we did on the same grant, the per capita grant, we brought on an additional senior sanitarian position to come in for 3 days a week. And so he's really, and all he focuses on is food inspections. That's it. Okay. Doesn't do any complaint investigation, anything like that. So, and he was a former employee here, so he knows us, knows the systems, and so he comes in and just does restaurant inspections. So we're keeping up because of him, and so hopefully over time, that need will, once everybody gets fully up to speed, we get our new database system, that, we'll see how long that goes, but typically, historically, we have 4 inspectors, and that's been able to do it, but we're always reviewing it going forward to see, do we need additional positions,
Kim's capable of doing all the inspections except food. I was going to put that in my report, but we're just waiting on the state. The state has to review the 10 lead inspections that she did, and I sent them an email 2 weeks ago. They haven't done that yet. Then she has to go out and get food cert. So we're hoping by the end of spring that she'll be fully certified. But she's been great. I mean, she has questions. Obviously, she's new at things, but she jumps right in. She does housing, septic. We help her with septic. So bringing on Jen is a huge help.
And John's, so every sanitarian sort of has their focus area of expertise. Everybody does everything, but everybody has their own area. Rob really does complaints and housing, and John focused a lot on septic systems. Ken was always about food inspections, and so Melissa Soricelli, who was already on staff, who's a seasoned, many years in the field sanitarian, and is fully capable of taking on John's area of expertise, and she's also very good at food as well. So in terms of content expertise, while John was great, we feel like Melissa can pick it up and run with it equally as well, and at the same time training Debrina and Kim on giving them more experience in overseeing them and from a review perspective to make sure they're learning how to do these things and learning how to do them efficiently.
Great.
All right, and I've got one quick presentation that I thought would be interesting. So we're in a step now that we do from time to time to look at, what diseases and conditions are trending in the town, and what are we looking at? And so the state disease surveillance system database allows some reports to be generated. And so basically, here's all the diseases that are reportable to the state and the numbers related to them. And so you'll see, like for example, with COVID-19, you had nothing we were always tracking coronavirus infections. We had nothing until 2020, and then we've been declining there. And you'll see, just a couple little hits here and there with some of these. Campylobacter is a foodborne illness. It's relatively level. Just moving on, like here's E. coli, just a handful of cases here and there. Influenza, it seems like we're, after we had a significant lull for a couple years, this is the COVID years here. The year 19 before COVID was very low. I think this is resulting from, there's a transition from reporting, and Henry might be more knowledgeable in this. You know, we used to count a lot of different, the paper reportable ones, the OLC 15 OLCs or whatever.
Right.
It's a paper form that would be sent to us, and so those were counted. So now they've transitioned away from that, and it's just lab testing, not in-office screening that gets counted. And so this year, I think, was the year that they transitioned away from that. This was the 2 COVID years, where this is 2020, where it was very low. And then 21, then we saw once all the COVID restrictions were lifted, you saw it go up a little bit, but it's come back down. You know, this most past year, this is 2023 over here. And so you'll see, we get a few cases of different diseases, RSV, you know, and so a handful of West Nile virus. So we'll take this data and ask me any questions, and, you know, interrupt if you want.
So I will interrupt just to say, so you're saying these are only diseases that were tested through like a lab test, and then were automatically reported to the town, basically?
Yeah.
And then, but so you mean it's screening, because like the strep ones seem very low based on there, so you're saying like if it was just like a screening in office, it's not necessarily it's not like a blood test, it's some...
Yeah, that wouldn't be considered a confirmed case, if you will.
Okay.
You know, so this is confirmed.
Even though those people are getting probably like a CPAC or like some sort of...
Yeah, so a physician can take a screening test and say, you know, the symptoms fit, I have a positive screening, you know, you guys can chime in on this, I diagnose you as having X, here's the treatment for this.
So certain areas are probably severely underreported, that's what I was just kind of curious about.
Yeah, so this is, you know, for when...
And then obviously the home testing and stuff like that,
that's not included in here. Yeah, none of that's included in here. This is, you know, when physicians collect, and the staff collect samples, send them to a lab, the lab automatically reports this stuff. So yes, it's undercounting in terms of actual cases, but as long as the trends follow, you can see the trends that it's lab reported cases versus, you know, they know like if there's X amount of influenza cases, the reality is probably about 15 times higher than that. Yeah. So again, we take this data, we look at it and say, okay, what are we seeing most of, and what are the trends? And again, this chart isn't great other than to show some spikes around Lyme disease, around babesiosis, around Campylobacter, are some of our higher ones, you know, a few cases here and there. Note the scale here. I took out on this one COVID, influenza, and RSV because it would throw the chart way off. You know, you can't have a chart with 2 cases and 9,000 on the same scale. So I took those out. But this is what we do, you know, routinely is we'll look at this data and say, okay, what are we seeing, and what do we need to be working on? Is there any activities that we need to be doing? Now, all of these diseases don't require a response from the health department necessarily. A lot of them do. But, you know, for example, like the foodborne illnesses, we'll interview some of those. But the state also, for research purposes, likes to interview certain portions, certain diseases, and that changes every year. So they'll do the interviews on some of those, but we have to do some. And so, you know, so again, you saw that Lyme disease is spiking. So we look at, here's, you know, Lyme disease cases and babesiosis, the tick-borne illness, to see what we're experiencing. And again, it's a relatively level trend. We saw a dip during the COVID time just before. We saw an increase here, and then we'll take a look at, you know, at 24 to see if this comes back. But again, with Lyme disease, our primary approach is education. We have a robust web pages, multiple web pages on prevention and education activity. We accept ticks for testing. We analyze ticks in-house to see if it's engorged, if it needs to be tested, if it's a deer tick, a dog tick, a longhorn, Asian longhorn tick. And so this is what we'll do. We'll look at this stuff and see if there's any trends going on, anything that's concerning.
Sam, I'm sorry, just real quick question. These are also, just for everyone, these are based on individual residences, right?
This is all Fairfield.
Right,
Yeah.
Fairfield residents.
Yeah.
So it's not where they got tested.
It's not where they got tested.
It's
This is where their town of residence. So yeah, everything, up here, this is all only Fairfield residents. And so here we took, the respiratory virus diseases and combined them. And you can see, very small numbers of RSV, and I only took the past 4 years for comparison purposes, because that's only when COVID was, and you'll see sort of the downtrend of COVID as we expect. Flu can come back here, not as much in 23, and then RSV, was always small. I think there's 2 cases in 20, 7, 121, now 302. I think it's just, that's partially, there's much greater awareness about RSV now and vaccines, and so there's been a lot of attention on RSV. So I think it contributes to some of the increase in testing. But, anyone will tell you there's more RSV cases going on, than have been. So just separating out flu, you can kind of see where we are with flu. We have the 22-year, but it's, maintaining relatively level, consistent. So that's local data. This is the state data for what we're seeing now in flu. So we're starting to see a slight increase. This data here is still incomplete on this last week, but we saw a peak here, then it valleyed out, and now we're starting to see a slight increase again in flu activity. This RSV is still trending down so far this season. And COVID, same earlier peak and heading down. As many of you are aware, we had a change in the CDC respiratory guidance, so I thought I'd share just some of the content that they provided to us. It's basically the cores are, vaccination, good hygiene, and cleaner air. Some of the justification behind this is that they're seeing, weekly hospital admission rates decreasing, COVID deaths decreasing. Some of the drivers here, they talk about, hospital admissions down, fewer deaths, fewer cases of MIS-C and long COVID are becoming less common. This next one I found interesting. So this is hospitalized adults between October and November and their vaccination status to show that, the vast majority of those who are hospitalized have no record of vaccination or no recent vaccination, no record of bivalent, the second sort of generation, or the updated monovalent, the third generation of vaccine. And you can see that most of the cases are, people, the people who've received the updated monovalent dose are much less likely to be hospitalized. This is all adults. I thought this one was an interesting comparison. This is continuing to show the justifications behind why they're reducing or changing the guidance. Back in January 2021, this is 100 boxes here, and here you can see, like, back in January of 21, you had 22 people that were had some protective immunity from vaccination, infection, or both, but 78 out of 100 didn't have any antibodies for it. Now, the recent studies show that, only about 2 out of 100 don't have any antibodies. Most people have some kind of protective immunity. And this is just a similar chart showing sort of the change in the trend over time. And this is one of the justifications they talked about is so we're seeing the same positivity rates with tests for the most part with, if you look at these pieces, with the exception of the peak here, you're still seeing the same test positivity rates, but deaths are not following those quite the same way. Deaths have just stayed much lower than the positivity rate, whereas here it was more likely following it in some ways.
Mm-hmm.
The death rate has declined. So again, just some of the goals that they're trying to achieve is just streamlining it amongst all respiratory virus illness. And then this is the sort of guidance sheet they came up with. Just some, just the graphics are pretty self-explanatory, and they're really breaking it down to 2 steps. They've reduced eliminated the 5-day isolation if you tested positive, starting from the days of the first time of your symptoms, to now 24 hours after no symptoms, with no fever, and then you can take normal actions, for the next 5 days, and taking some level to protect others when you're around other people indoors. And if you test positive but you have no symptoms, just basically taking some protective steps around others when you're indoors, and to consider if you're going to be around high-risk people to add additional protective measures. I thought I'd show you this one. This one I found as the last one because it's so colorful, but also this is intriguing to me in that it shows the trend over time with different variants. And so it's starting upper left down to the bottom right, you'll see each variant kind of coming in over time, growing to be the most dominant variant, and then kind of declining, and the next one coming in, and the next one coming in. And so you can see now we're in that second to last box, the JN1 variant is, just rapidly increasing. The good news is vaccines are effective against them and continue to be protective. But I just found that a very interesting graphic to share. And so that is my report.
Great. Thank you very much, Sam.
Sure.
Great. Thanks, Rob.
You good?
I'm good.
Okay. Just for on the environmental section, Sam's brought up the FDA code that was brought in February 2023. In January, we do our food service manager exams. This year, normally we do 1 day and then we do a test. This year we had to expand it to 3 days. We had 67, employees, restaurant owners, managers that came in to take the class. It was the largest class that I can remember since we started doing it. Well, we did it before I did it, for about 30 years. Kim and Debrina split it up. For years it was Sam teaching it, then it was me, then it was Melissa for a short period of time, and now it's gone to Kim and Debrina. So they did the presentation portion of it, they taught the class to everyone that came in, and then I'm the certified administrator, so then I came in and gave the exams for it. So it was a good turnout. We were also able to do it on a drastically reduced rate compared to private exam options, so that was great. The other thing too, to keep up with the FDA code, the Food Protection Program at the Department of Public Health gave us these food allergen awareness posters to be handed out to every establishment in town. So we did a mass mailing emails telling them that they can come pick one up. It's written in English and Spanish.
This is a new requirement that the restaurants are obligated to have a poster telling employees about food allergens. This is the employee side.
Yeah. So this will be, they can put it in the back room on a poster. And surprisingly, Friday was the first call I've ever gotten about an allergic reaction that happened at a local establishment. In 25 years, I've never gotten anybody that called and said, oh, we had an allergic reaction. It seemed to be a mix-up between certain type of salad dressing to another. The mother was very concerned, but it was the first time I ever gotten a call such as that. But the establishment was great. They were really receptive. They got on it right away. They made multiple phone calls today. Actually, I think they were going to try to reach out to the mother of the daughter who had the allergic reaction because they wanted to make sure to figure out what happened so they can prevent things from happening again. We sent out our applications for cosmetology, which we always do this time of the year. We had an unfit dwelling complaint late at night. I think it was Sands went out on it. So was it a Friday or a Thursday or?
I forget what night of the week it was. It's like, you're sitting down and you're just like starting to drift off and it's like, oh, well, that's the number. You notice it on your ECC, that's not good. But
So Sands moved out on the original complaint, and then I followed up with, Mark Barnhart and, Allison from Social Services. This brother and sister, they've been on the radar before. The town has helped them out with, roofing at the property, other things that they needed. Both of them are still, I think they're at the Carlton, which is good. Mark Barnhart did find funding to repair the plumbing. They cleared out a little bit, but not a lot. We were involved with it with building too, because there were some electrical wires or cords, extension cords that just, because one of them was in a wheelchair, just constantly going back and forth over the cords on the wheelchair to the exterior.
This was a private home?
Yeah, it was a private home, yeah. So they're still at the Carlton. One of the things that we were waiting on to make sure that they have adequate lighting. They do have a friend in town that the sister happens to be an attorney, so they really help them out. They're continuing to help them out. I'm not sure if they will go back. They really just need lighting in there, but I don't think it'll be something that they won't be able to fix. I'm just not sure health-wise if they will be able to go back into their house.
And I think you said probate has appointed a conservator.
Yeah, it was.
So that person's taking the lead on and making the determination of whether they go back, whether they find alternative housing.
Which was good, because there were some neighbors that were getting involved, so it was good that an attorney stepped in and is going to help them out. I also spoke about Kim, but Santino also still waiting for field training from the state food protection program. We're hoping it does get done in the springtime, because temporary events really start picking up, and then Santino really wants to pitch in on the weekends or as much as she possibly can. Same with Kim, so we're hoping that will get done. I sent an email a couple of weeks ago. I don't want to be too annoying to them, but I'll probably send them one again. They do have 6 individuals in front of them that need to be field trained, so we're hoping that goes fast. In the springtime, it always seems to be times for trainings. So we have the lead training for inspectors, risk assessors. 3 of us are going on April 25th. It is a required recertification once a year. It's a full-day course. I'm going to go in May just to break it up to make sure we have office coverage. It's a full-day course followed by an exam that we are required to take yearly. So we'll be following up with that. Kim and Emma Sharp are going to go to an Epi Ready team training. It's a 2-day training that is sponsored by DPH, CDC, and National Environmental Health Association. It's an Epi Ready team training. It's a nationwide initiative to enhance the confidence level of public health professionals likely to participate in foodborne disease outbreak investigations. So that'll be helpful. Kim is actually, she can't go to establishments if we get complaints about, if we get reports that somebody may have salmonella, we have to follow up on it. She has been doing interviews, but she can't go out to the establishments and do any follow-up.
Do the environmental work.
Yeah, the environmental portion of it. So myself or Melissa or even Sabrina will follow up depending on whose establishment it is. But they're looking forward to the training, so I'm sure it'll help them as they become new in the environmental field. Sabrina is actually going to another training, vector-borne disease training at the Connecticut Agriculture Center. It's a 1-day training. She'll be attending that. I will be going to a housing code officials training. They are touching about different things about lead training. We don't have a lot of lead ever in town, but we all keep up with it the best we can. So that
we have a lot of lead, blood lead elevation.
Yeah, sure. Yeah.
Lots of lead in town.
Yeah.
In terms of any house before 78 is likely to have lead. Any house before 86, lead in the paint. Any house before 86 is likely to have lead in the solder.
Yeah. So we'll be doing that. And like Sam said, we did get some complaints about houses without certificate of rental occupancies. So we did send out orders to comply. We actually had another request for information the last couple of weeks that Andrea worked on. We do have some houses that we sent out orders today because it's so late in the season. As we find out about them, we verify and go right to an order so we can speed up the process to get a certificate of rental occupancy. We haven't really received any overcrowding complaints at all. It's been kind of quiet except on our end, except SantaCon complaint, which is still really not our end. So that's good, but we have sent out other orders and hopefully, we get compliance with those. But that's pretty much on the environmental side.
That's great. Thank you very much.
You're welcome.
So were there any communications from public, anybody?
Had none?
I have one quick question,
Sure.
follow-up to the opioid funding.
Mhm.
As far as Narcan, within that, is there like an additional distribution program in there, and like who from the town theoretically could participate in that?
Yeah, so that's one of, so we've,
I remember hearing about it
Yeah,
before, more in the
various-
realm of like nursing in the schools and everything, but I'm wondering how much it's been extended to the general public, or even just like healthcare providers, et cetera.
so for a few years, Fairfield Cares, which Santina's
Yeah.
is part of Fairfield Cares, has been offering Narcan training for the community in general. All the police, all the firemen, all the EMS, all the nurses have had it, and they have it in stock. And Narcan is much more widely available now. And so, but that's an effort, that's the harm reduction part of it, is to continue that effort in making sure that anybody who wants training to use it and Narcan itself can get it. So that'll be a portion of the set
So
of
that'll
funds.
be anyone who wants to. Okay, in addition to obviously all the education component, I think that's super important. But, I was just thinking of it more frequently because of how many houses I go into, and it's like, you never know sometimes what you
So every
would comprise,
month,
you know?
the second Thursday of every month up at the Woods Library, they have it at 6 or 7 p.m.
Okay.
Okay,
Is that
They have
Fairfield
it
Cares doing that?
Through Fairfield Cares and
Yeah.
Positive Directions, it's free.
okay.
So any
I'll check that one out.
resident can go to that
That's the
training.
education part, though, right? They
Yeah.
don't
They
give
train you
Narcan.
and they give you Narcan
Oh.
there.
Yeah.
Once you're trained, they
Lots of-
provide the Narcan.
Narcan available for free,
Right.
and, that you can get.
Oh, that's great. I didn't know that they provided it. That's good.
Thank you for
Sure.
clarifying. Okay, that's all for me.
Any old business or
Have none?
unfinished business? Any new business?
We have none?
Any other comments? No? All right, okay, I have a motion to adjourn the meeting.
So moved?
All in favor?
All right, and I was negligent